Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, will this New Year's Day join mothers in welcoming their newborn bundles of joy at the Leratong Hospital in the West Rand district. So during the ceremony, mothers will be presented with babies' gift hampers. Let's get more. SABC News reporter Mbalenhle Mthethwa brings us those details. Mbalenhle, good morning. Happy New Year. What an exciting time. Of course, we're looking at the number of babies that are being born, the support and offer to the mothers as well, and some of the challenges as well. Tell us a bit more about what's happening on your end. We can see lots of gifts in the background.
Okay. Yes, certainly. There are a lot of gifts here. And I'm going to ask my camera colleague to frame the MEC who's about to speak to us right now, as it is a new year. And she is going to give us an update on the New Year's babies. Thank you so much, MEC, for taking the time to speak to us. New Year's, Christmas Day, usually very special events where we count the number of babies who are born on New Year's Day. And how is it looking so far this year?
I think so far we're good in terms of the numbers. As we have seen even last week, our numbers were not extremely high. And the babies are there, they are beautiful, those bundles of joy, and their mothers are happy to have the children. Here in Leratong Hospital, we have 5 babies, and all 5 of them are girls.
Oh, wow, that is so beautiful. And I see you've also come bearing gifts. You did not come alone. You would have seen our camera colleague has shown our viewers all the gifts that you've come with. Why have you come with these gifts, and why is it important to come and see these mothers who are here?
Because this month is a month of giving. So when we come and visit anybody, but it's in our culture, you know that I can't come and visit a child without anything that I'm having. So we've got these beautiful gifts that we want to give to the mothers. But again, this is the fresh start as a mother when you have this, because everything that you need here inside this big bath. But it's having all the things that are necessary that mothers will need. Definitely that they will want to use.
You can talk us through them. I mean, as we are live, I mean, as we can see.
Every mother wants this one because you can't wash the nappies in the morning, and you can see those little heads, that you can see those little booties, and you can see inside there's quite a number of issues, like even the things that you must just make your child smells good. I used to use that one. You can see that cream. Okay. That's one of the best creams that we're even recommending in the hospitals that people can sell.
Sorry, MEC, I just have a question. In terms of teenage pregnancies in the province, have you had any here at Leratong and overall in Gauteng?
Unfortunately, no, in Leratong we don't have, because the young one is 18 years old at least. Because last week where we were, the young one was 16 years old, and I'm happy about that. In fact, I'm not even proud of the 18-year-old too, because definitely she was pregnant when she was 17 years old. But we're encouraging now everyone to make sure that we follow every necessary steps. As mothers, we must start at home first of talking to our girls. When should they think they can practice sex? But if they are doing that, what are the things that they are going to experience as young children? So at least now people are understanding, because we have that strategy that we've developed as a province in 2023-24 financial year. We started implementing it last year. Our numbers dropped in Gauteng drastically, and even now the numbers are going to drop.
And overall in Gauteng today, do you have any teenage pregnancy births?
This afternoon I will be having a consolidated list that will talk to the numbers, whether it's females, how many females, how many males we have, and how many number of children that have given birth to children, because I always say it's a child giving birth to another child, which is a problem, because that's something that we need to deal with as a society. Hence, you can see I'm working very closely now with the religious leaders. We've trained some of them to be chaplains. Hence, they are the Department of Health chaplaincy. We train them through the University of Vets, and it's helping us, the group of chaplains that we have in the whole province, because in the strategy we're talking about bringing all the stakeholders together to work together, and this is the results now that we're getting after this work that we've done of developing the strategy. So I really appreciate the team, my team, in fact, in the Department of Health, working then with other departments, sister departments, because we brought in Department of Education and Department of Social Development. You know, in 2 weeks' time, we'll be hitting the ground running, going to the schools, talking about the same thing of teenage pregnancy, what must be done as parents at homes first, as the society, working with the religious leaders. Even the visits that I do to communities, I work with them. I don't go there alone and talk about those critical things. And we have brought in even the traditional leaders now that are residing in Gauteng to assist us in the process of building the health care that everybody will be proud of in the province of Gauteng.
Okay. Now, we know that there might be some challenges with regards to infrastructure and so on. Do you perhaps think that there were any challenges in the Gauteng province pertaining to, insufficient beds or insufficient, just generally capacity challenges as a result of overflooding, overcrowding in hospitals?
We had very old infrastructure in the province. In fact, I was saying earlier, in the past 3 years, we are not just maintaining the infrastructure, we're refurbishing the hospitals. And you can see here, Leratong Hospital is one of the oldest hospitals, but we are busy even now. Construction is on, contractors are on site. All the 37 hospitals, you'll find contractors there because we are facelifting our hospitals, but we are maintaining them, but we are refurbishing with the wards where you can see that these wards have been dilapidated. And I'm really proud of the work that we've done as a Department of Health. I still want to invite you, by the way, to that round that I want to do to all the hospitals, that we must check the hospitals. We have the best hospitals now, ideal hospitals that you'll expect. One of those is Mthethwa, Mamelodi Hospital, Pulusong Hospital. I can count quite a number of them, regional and district hospitals. But I want to take you just right next door at Chrisani Parakwanath Hospital. The work that we have done there in terms of improving the infrastructure, it's quite big. It's 3.7 bedded, and it's not supposed to be that size, remember? But we've improved it, we've changed it, and we're moving towards getting it better, to be at the same level with Steve Biko and Charlotte Maxeke Hospital. Same as Dr. George Mukar. We have contractors on site as we speak that are refurbishing the institution there. So we're going very well in terms of the infrastructure. We're doing extremely very well now.
Lizo, as you can hear, the MEC indicating that they are doing quite well, and she will be taking us through to the wards and just showing us the mothers who have now given birth. And as you can see, this is the ward where the mothers, the 5 New Year's mothers are, and we will get an opportunity to speak to them a bit later on today. But this is the ward with all the mothers, the New Year's babies were born last night. It's back to you in studio.
Thanks, Mbalenhle. I know we are looking forward to more rounds happening at the hospitals as we, of course, monitor, some of the bundles of joy, the mothers, how they're doing, and speak to some of the challenges and even just the celebrations, given the capacity and the resources as well. That's our reporter, Mbalenhle Mthethwa.